On Monday, May 4th, Novant Health facilities statewide resumed non-time-sensitive and non-emergent surgical procedures. Additionally, Novant Health clinics have begun reinstating appointments for routine care that had been delayed, such as pediatric well checks, chronic care visits, and acute care visits. We're here at Novant Health Mint Hill Medical Center to help you understand how this decision impacts the population right here in Mint Hill.
These are the Mint Hill Times.
In accordance with guidelines from the U.S. Surgeon General and the American College of Surgeons, Novant Health joined other health providers across the state in rescheduling non-essential surgeries, procedures, and appointments effective March 18.
Back in March, when we started to see the increase in spike in cases for our region for the COVID virus, we certainly wanted to reduce exposure to patients that didn't have the virus. By decreasing the amount of people coming into either physician practices or into acute care facilities, you would reduce the number of people that were exposed to either carriers or people with the active virus.
What makes now an appropriate time to resume non-time sensitive and non-emergent surgeries?
All of those cases that we had paused on, we really needed to get back to taking care of those patients. We had our safety precautions in place, we had our education in place for our teams, universal masking. We were ready to introduce those other patients back into the facility.
When is it appropriate to seek virtual care, and when should you come here and see a doctor in person?
Virtual care is never a negative. If you start there because you're unsure, the physician can always refer you into the emergency department, a Go Health, an urgent care to actually lay hands on and be seen.
Can you talk a little bit about the COVID-19 cases that you've seen here?
Well over 400 patients have been tested in this facility and 39 have come back positive. Some of those were discharged home from the ED and received a call about self-quarantining, and then some of those were our inpatients that received a positive and were transferred uptown to Presbyterian Medical Center. We want you to see your physicians. We want you to have your procedures done. We want you to be healthy. It's all about following the precautions, washing your hands, wearing your mask, being mindful of what you're touching and the environments that you present yourself to. But absolutely, we want you to be safe, we want you to be healthy, and we're here and ready to take care of you.
After 7 or more weeks of social distancing, staying home has become our new normal. Many people continue to be understandably wary of leaving their homes, but waiting to be seen or avoiding the hospital can be deadly, particularly for those with heart attack, stroke, cancer, or diabetes symptoms. If you are concerned about your health, please get seen as soon as possible.
Please click subscribe to stay up to date on the latest Mint Hill news and information.